distinguished guests and friends watching live across the Commonwealth, it gives me enormous pleasure to welcome you to this Commonwealth launch event for the Tribute of Life project. Today, the 14th of March 2022, is Commonwealth Day, a day which is set aside each year to remember and celebrate our shared history and friendship. I am Dr. Dale Gardner, an Associate Medical Director with NHS Blood and Transplant, and I will be co-hosting today's launch event. 20 years ago, I left Australia and made the United Kingdom my new home, commencing work as an intensive care doctor. 14 years ago, I added to that role by becoming a leader in organ donation, first in my hospital and eventually in a national position. That's my story. What's your story? Are you, like me, a Commonwealth citizen committed to donation and transplantation? Because I hope you are. The need across our Commonwealth is great. Organ failure and the need for transplantation remains high in all countries. Sadly, it's estimated that up to 10% of all transplants worldwide are unethical and commercially driven. Today, therefore, marks the beginning of something big, ambitious, and bold. But we are not here alone. Friends across the Commonwealth have joined us in support. Some of this support is right here in this room. It is my humble pleasure to introduce to you Her Majesty's Lord Lieutenant in the West Midlands and Chair of the Birmingham Organising Committee for the 2022 Commonwealth Games, Mr. John Crabtree, OBE.
Good morning, everybody. A very predictable Monday morning in Wolverhampton, sun shining, quiet entrance, the sort of things you get to know if you come to this part of the world. It's very good to be here. So what I was thinking about today, alarmingly, I realised that I'm in my 6th year as Lord Lieutenant of the West Midlands. I don't know how that time has flown. The only good thing I can say about it is I can still get in this uniform without having to let it out at all. But during that time, very early on, with all the privileges that came with this role, I began to learn quite a lot about the world of organ donation. As it happened, my father was a surgeon, but he was an ear, nose and throat man, so I don't think he was replacing any ears, noses and throats, certainly not in my time. So my personal knowledge of organ donation probably was limited to knowing about Christian Barnard at that time, and not much more than that, no personal experience at all. But very quickly, in my very early days in this role, I discovered that I'd inherited from my predecessor, who I'm delighted to say is here today, Paul Sabapathy. I inherited a really talented battery of medical DLs, and they didn't hesitate to start telling me about the movement and bringing it to my attention. So these are names that many of you will know. Elizabeth Duggins chaired the UK Organ Donation Task Force. It was her recommendation, that task force in 2008, that improved the rate of organ donations by up to 50% over the following 5 years. And she went on to lead the implementation of the UK's ongoing organ donation strategy. My very good friend and deputy here, Dr. Satya Sharma, a retired Wolverhampton GP, has tirelessly promoted organ donation for over 30 years. And the fruits of his great labour and his terrific energy, frankly, are here today in this very special gathering that we're all part of. Professor Deirdre Kelly, I saw her when I came in there, she was down there. Another one of my deputies was the inspirational founder of the liver unit at Birmingham Children's Hospital, providing an international service for children undergoing liver transplantation and developing what has now become the most active provision in Europe. And Colonel Hardy Doughty, yet another deputy, a consultant in transfusion medicine for NHS Blood and Transport. You can well understand that I wonder why I was the Lord Lieutenant and I had all these distinguished deputies. I've mentioned Paul already, so Paul was my predecessor, Paul Sabapathy, as Lord Lieutenant, and he had a personal connection and was in the course of establishing a charity in the name of his then wife, Wynne, who sadly we then lost, to carry out innovative work in helping potential kidney recipients and their families. I mentioned Heidi Doughty before. She was at the time county president of St John, and she explained to me a very significant Lord Lieutenant annual responsibility here in the West Midlands, where, with the approval of Her Majesty the Queen, the Order of St John presented awards to the families of donors, recognising their selfless generosity in giving others a chance of life after their death. And those evenings made a very deep impression on me, as you can understand, meeting all those families. And sadly, the pandemic suspended them, but I'm delighted to say that I've now got another couple of appointments in my diary later in the year. And for those who know him, it will come as no surprise that almost immediately it was announced that I had been appointed chair of the organising committee for this year's Commonwealth Games. Satya was on to me in a flash, explaining to me the transformational power of sport, as if I didn't know, but he made absolutely certain that I did. And he explained to me that the Games could be a catalyst for promoting the really precious humanitarian gift of organ donation across the Commonwealth. And it started with thoughts of a memorandum of understanding between the United Kingdom and Commonwealth countries to improve health and to lead through to social change, leveraging, of course, what will be the global setting of friendship and historical ties that will be identified by the Games. But before long, his terrific energy and the great support he received from senior members of the NHS brought forward the idea that we're here for today, what became known as the Commonwealth Tribute for Life project. And not just one memorandum of understanding, but many, connecting health professionals across the Commonwealth, sharing knowledge and expertise for the benefit of Commonwealth citizens. And I can't possibly just use those words, senior members of the NHS, as I just have, without specifically highlighting the contribution of Dale Gardner. He's been the key member of the core team, meeting for up to 2 hours every week for the last 2 years, chairing the International Advisory Panel for the project, and the man who's going to be responsible for seeing through the work after today's inauguration. There are so many strands of legacy developing around the Games, as you would expect. I could probably be here for the rest of the day explaining all those to you. Some of them are in hand, some of them we're working on, some of them are aspirations that we still need to achieve. But this is a very, very special moment and a very proud day. It's the 14th of March, of course, 2022. It's a Commonwealth Day, and we're here to launch this fantastic project. Our hope is to increase this life-saving area of medicine across the Commonwealth and help address UK and global issues of health inequality and, of course, unethical transplantation as well. And I've been kept regularly and closely informed right from the very start through my membership of the UK Advisory Panel. And I can't tell you how proud I am to be here today, to be part of the Commonwealth Tribute for Life. And with those final words, its launch is now officially underway. Thank you.
Thank you, Lord Lieutenant, for your words of welcome and commitment to this project over many years. I'm sure we wish you and your organising committee the very best as we prepare for the 2022 Commonwealth Games in Birmingham. Joining us now live from London, I would now like to welcome the Secretary of State for Health and Social Care, the Right Honourable Sajid Javid, who will formally launch the Commonwealth Tribute to Life project.
Thank you, and happy Commonwealth Day, everyone. It's an honour to join you today to launch this life-saving programme. You know, the Commonwealth as an institution is very close to my heart. My father and my mother came to the UK from Pakistan, and as many people may know, they settled here. I'm really proud to have those roots in the Commonwealth. And now I'm the MP for Bromsgrove, which isn't too far from where you are all meeting today, just down the M5. And I'm proud that such an important event is bringing together people from across the Commonwealth right there in the West Midlands. Now, COVID, you know, it's been a lot on my mind. And one of the things that we know about COVID now is that much of the world is really properly starting to vaccinate against this disease. And just a few days ago, when I was at the CEPI conference, we learned that some 5 billion doses have been received across the world. Much of this is thanks to many nations, including Britain, that have made many donations, but also to initiatives like COVAX that have clearly demonstrated what we can achieve, all of us, what we can achieve together when we learn from one another. And so I think we must apply these lessons across the whole of healthcare. And there's no better place to start than improving access to ethical donation and transplantation. By sharing expertise across the 42 nations that make up the Commonwealth, we can not only improve lives, but we can save them too. You'll be hearing some truly moving stories today about how donation and transplantation can give people the opportunities to follow their dreams and to properly, truly achieve their potential. We've made great progress, for example, through close cooperation here with the NHS in this country and the Mohan Foundation in India. But we do need to learn the lessons from the pandemic and look at what more we can do to work across borders. For instance, no country, not one in the world yet, has achieved self-sufficiency in donations and transplants, and meaning that everyone who needs one can get one in their own country. That doesn't happen anywhere yet, sadly. And there are also some very large disparities in rates of donations, not just across countries, but also between socioeconomic groups, between ethnicities and religions. The obstacles in our way are ones that we all share. But this means that the solutions are shared too. The Tribute to Life project will make a big difference, helping us all to tackle the disease of disparity and to strive towards self-sufficiency. It will help us to share safe and ethical best practice and crucial expertise on running transplantation programs with a special emphasis on harder to engage groups. This is a huge step forward, and I'd like to thank everyone in that room today, everyone that's joining us virtually, and everyone who has joined from wherever they are across the Commonwealth for showing your commitment to change today. Whether it's from Antigua to Zambia, we must all build up on the deep historical bonds across the Commonwealth so that we can overcome this 21st century challenge. I want to thank you all once again for your exceptional efforts, and I'm looking forward to hearing about the lives that this brilliant project will save in the months and years that lie ahead. Thank you all very much for inviting me.
Thank you, Secretary of State. For his words and encouragement as we launch this project today. It is now my honour to introduce the Mayor of Wolverhampton, Councillor Greg Brackenridge, provide a personal welcome to Wolverhampton, which is located in the West Midlands of England, where today's launch event is being held.
Well, thank you very much for that warm welcome. I'd like to say to the Lord Lieutenant, Secretary of State, dignitaries, and those present in the room, and those joining us online, a very warm welcome to Wolverhampton. I have the honour of being the Mayor of the city that I was born and raised in. Still call it my home to this day. We're a very warm people. You ask anybody in Wolverhampton, we welcome everybody. We are a city of sanctuary, which will be particularly useful with the Ukraine issue at the moment, and our thoughts and prayers go out to all of those people. We will be here to welcome you when you arrive. We've got many traditions in Wolverhampton. We're very warm, we're welcoming, we're stoic. We also like to poke a bit of fun at ourselves sometimes. Recently, there was one of these polls where a couple of hundred people got involved and answered, and it was the most miserable place in the UK. And Wolverhampton came third from bottom. The only thing that Wolverhampton complained about is that we didn't win. So the Wolverhampton people are very good at looking at themselves with a little bit of humour. We've got a long association with organ donation in Wolverhampton, and we are the place of origin for the NHS donor register, organ donor register, which commenced in 1994. This is all thanks to the work of Mrs. Rosemary Cox and her family. They're with us today. We are honoured that Rosemary and her daughter can be here. The Cox family began their campaign for National Organ Donor Register following the sad death of Peter Cox, Rosemary's son, and Christine's brother, who became an organ donor in 1989, helping 17 people. Both of them inaugurated a donor memorial in New Cross Hospital in 2016. Last year, Rosemary was recognised at the Pride of Britain Awards with a Lifetime Achievement Award, and Christine Cox was awarded an MBE in June 2021. Very well deserved. Currently, I am informed there are over 28 million people registered on the NHS Organ Donor Register, representing 42% of our population. I would like to thank NHS Blood and Transplant for choosing Wolverhampton to launch the Commonwealth Tribute to Life, which will be a magnificent project to promote organ donation in all Commonwealth nations. This humanitarian project will be instrumental in achieving progress for all participating nations, and I am excited to be here today to learn more about it. As has already been mentioned, there are disparities between the groups who receive organ donations. We are particularly aware in Wolverhampton, following the sad death of one of my councillor colleagues of his daughter, who was undergoing a heart transplant. There are certain communities, particularly our minority communities, that need to come forward in larger numbers to ensure that people from those communities can receive organs. We have worked very hard since that very sad and tragic moment with Bhupinder Gakal, who my councillor colleague, to try to register more people from the various communities in Wolverhampton. This is really important. So I would urge you all today, and I'm sure you're all on the same hymn sheet as us, to take that message out. Let's get more people on that register, and let's make sure that everybody who needs gets the organ that they require. This saves lives, and that's important. We've all realised over the last 2 years of this pandemic just how important other people are. I hope that when we move to the new normal that we keep hearing about, that we keep hold of those traditions. I often say we've gone forward 20 years in digital technology, but in the way communities look out for one another, we've gone back 50 years, and that's a good thing. People are checking on the elderly neighbour. People are looking out for one another, helping and assisting where they can. But one thing for certain, we know how important all people are, and the pandemic is the one silver lining of the pandemic that we're all reminded about. Thank you for choosing Wolverhampton. Thank you for being here. I'm excited to learn more about this project. Thank you.
Thank you. Well, thank you, Mr. Mayor, and we are very glad to be here in Wolverhampton with the Cox family in the birthplace of the NHS Organ Donor Register. It is now my pleasure to ask Mr. John Patello, Chair of NHS Blood and Transplant, to respond to these welcomes we have heard and say a few words.
Good morning. So I'd like to start by thanking the Lord Lieutenant and the Mayor and the Secretary of State for their inspiring words of welcome and support. The very best thing about my job is getting invited to events like this, where there's such a strong sense of purpose and positivity. Now that's, of course, because of the life-saving work you're all doing, but I think it's also because of the passionate engagement of so many members of the team. And in that context, I'd like to thank all of the speakers today and all of you who've helped make this event possible. I would especially like to recognise the support given by Mr. Paul Sabapathy, the former Lord Lieutenant of the West Midlands, and to thank Mr. Gary Sambrook, the Member of Parliament for Birmingham, Northfield, for joining us today. For those watching across the Commonwealth, I thought you might like to know some more about our work in NHSBT. We provide blood services in England, and we are the organ donation organisation for the UK. Our work in organ donation includes leading, marketing and promotion, managing the NHS Organ Donor Register, employing the specialist nurses who support families and coordinate donation, leading a network of clinical champions in every acute hospital, managing the transplant waiting list and allocation system, and commissioning the National Organ Retrieval Service. So in effect, we own the system for donation and transplantation in the UK. Our mission is to save and improve lives. And over the last 10 years, we've increased organ donation rates by around 60%. And today, 57,400 UK patients are alive with a functioning transplant. These achievements are made possible by top-quality collaboration across a very wide network. Of course, the NHS, patient groups, commissioners, and government. But most important, all progress depends on our amazing donors and their families. But the job's far from done. We still have over 6,000 people on the UK transplant waiting list, and we've recently launched a new strategy called Meeting the Need, which we hope will increase the number of transplants and help to reduce inequalities in donation and transplantation. Maybe that's enough about the UK. Today we're here to talk about the Commonwealth, and the original meaning of that word was the general good. And I think we can all benefit from working together. Sharing our knowledge and expertise can surely be the foundation for success. Why collaborate? Well, we faced a common challenge. Organ failure and the need for transplantation remains high in all Commonwealth countries. Deceased donation rates vary widely from 0 in some countries to over 20 per million of population in others. But no nation has succeeded entirely in meeting their needs. And sadly, that gap leads to the deaths of those on transplant waiting lists or to unethical transplantation. The ambition of this project is clear. Through sharing knowledge and expertise, we will increase ethical organ and tissue donation and transplantation, regardless of transplant infrastructure, for the benefit of all Commonwealth citizens. NHSBT is proud to be leading this project, especially in this year of the Birmingham Commonwealth Games. And there can be no better moment than today, March 14th, Commonwealth Day, to launch a project which uses our historical ties and friendships to unite us in a noble effort to save lives. Thank you all very much for your commitment to the Commonwealth Tribute to Life project. Thank you.
Thank you, John, for your words of encouragement and your leadership of NHS Blood and Transplant. I now welcome onto the stage my co-host for the rest of this launch, Mr. Justin Grace. Justin is no novice to Commonwealth events. Justin represented New Zealand in cycling at the 2002 and 2006 Commonwealth Games and now works as a coach with the Great Britain cycling team. That is not the only reason Justin is with us today. Justin is a valued member of the UK advisory panel for the Commonwealth Tribute to Life project. And I understand, Justin, that you've got a personal reason for being so committed to this project.
Yeah, thanks, Dale. I've got a few reasons to be here today and to be involved with this project. Firstly, I'm really a citizen of the Commonwealth. I was born in Canada, so I'm a Canadian citizen. I grew up in New Zealand. I'm a New Zealand citizen. And now, as of last October, I'm also eligible for my British passport. So I really am. I spend enough time in Australia, but nobody wants one of those. Sorry, Dale. Secondly, and I think one of the main reasons that I'm here, I am a liver transplant recipient. In 2016, finally, my liver decided after more than 2 decades of disease that it had had enough. And in Leeds St James Hospital in November 2016, I was fortunate enough to be the recipient of a donor that came from the register. So I have a really first-hand feel for what this means. I would definitely not be here today. I was given 6 months to live, and that's a lot more time that I've had with my family and to be able to support projects such as this. As Dale mentioned, I was also competed. This is actually me competing for New Zealand against the Canadians in Manchester at the Commonwealth Games in 2002. So that link continues. I raced throughout my career for Canada and New Zealand. Canada in the early days, New Zealand later, and then came and became the coach of New Zealand, and now for the last 8 years, one of the coaches in the Great Britain cycling team, going through Commonwealth and Olympic Games. The last Commonwealth Games was in Brisbane, and I was proud to be there as part of Team England. So that's a little bit about where I am there. And lastly, of course, I'm also a patron of the Donor Family Network. I think everybody's wearing their pins today very proudly. This is our memorial at the National Arboretum, and I'm very, very proud to be able to be a part of that, that charity and seeing life from the other side of the fence, so to speak, to have all of these incredible families supporting people like myself, and for me to be able to get the feel for what those families go through. Thank you, Dale.
Thank you, Justin. That's a powerful story. We have been speaking for some time about the Commonwealth Tribute to Life project without perhaps fully explaining what we hope to achieve. We have a 60-second video to tell you more.
Organ failure and the need for transplantation is high across all nations, leading to the death of thousands of patients each year. With the help of the historical ties and established relationship of our Commonwealth nations, we aim to create a memorandum of understanding on organ and tissue donation and transplantation through which we can share knowledge and expertise. We believe that we can encourage transplantation in nations that have none, expand on previous success in nations that have established programs, address issues of health inequalities in transplantation, and protect vulnerable Commonwealth citizens against illegal and unethical transplantation. It is our hope that by doing this, we will save and transform the lives of those in need of transplantation across all social groups and ethnicities of the Commonwealth. We are inviting all Commonwealth nations to join this humanitarian effort. For more information, please visit www.odt.nhs.uk.
No project like this emerges out of a vacuum. Projects like this have a history made up of people who have worked to see this day. No one has worked harder than Dr. Satya Sharma. Satya is a Deputy Lieutenant in the West Midlands and a retired Wolverhampton General Practitioner. Satya dedicated over 36 years in the NHS, and voluntarily he has given over 30 years to the promotion of organ donation. I first met Satya in 2012, and even then, Satya had a long history of successful promotion of organ donation in the West Midlands, and particularly in British Asian communities. Through Satya's efforts, he was able to help guide the creation of a Memorandum of Understanding in 2015 between NHS Blood and Transplant and the Mohan Foundation, a not-for-profit organisation in India which promotes organ donation. Satya went on to co-chair the UK Implementation Committee of this memorandum. The aim of that collaboration was to share learning between the Mohan Foundation and NHS Blood and Transplant. It will surprise no one that the success of that endeavour was the inspiration for the Commonwealth Tribute to Life project. Satya will be sharing some of this journey with you, but I know he will be too modest to acknowledge his own contribution. Nearly every individual who has joined this project from across the Commonwealth has done so because Satya personally spoke to them and explained what we are hoping to achieve. He will not tell you, of the hundreds of phone calls he has made at any time of day and night that he laboured through to achieve this launch today. But I tell you, so you will know and recognise, just as I do, Sacha's influence, vision and unflagging drive. I present Dr. Sacha Sharma, Deputy Lieutenant in the West Midlands and Chair of the Commonwealth Tribute to Life's Project Board.
Thank you, Dale, and thank you for your warm welcome. When we started the project, it was like being in the middle of ocean, not knowing where the shore is. And it was difficult if you were in your own boat, just trying to get to the shore. I had a dream. The dream was helped by some people. And I must say that this project has turned out to be like no other. We hope that we'll be able to show you today why that is so. I was very persuaded by the argument that if it's not difficult, then it's not worth doing it. The journey for Tribute to Life, as you might have heard, it started in October 2018 when our West Midlands Lord Lieutenant John Crabtree, he was appointed the chair of organizing committee. We had a quiet conversation in Wolverhampton Council boardroom, and it grew from there. Quite simply, John asked why, who, what, when, and I hope that I'll be able to show you the answers to all these questions in next few minutes. In May 2019, in Warwick University, Coventry, Nithya Krishnan, who is a board member, she organized an international conference, and half a day of that was dedicated to Memorandum of Understanding creation for Commonwealth countries. In October, Baroness Finlay, who is with us today and also chairs the UK Advisory Panel, she was very kind in hosting a reception for the top team of NHSBT. And that went very well because the top team was not only persuaded, it didn't need any persuasion, they totally agreed that this is a project well worth doing it. And the fruit of today is purely because of NHSBT coming together and supporting the project in such a wonderful way. In February 2020, we had the first board meeting, and the intention was that although the Commonwealth Games are going to be in July 2022, we wanted to deliver the project in March 2022, 6 months ahead of Commonwealth Games. And with the blessings of all of you, and vast number of you who are in the room, and quite large number of you who are not here today physically, but are with us virtually, this has taken place. We're right in the middle of March. This was the reception which took place in House of Lords, and all the top team members were able to come. We were very quick in establishing the structure, how we are going to do it. The board was established, and it was to be called the Board for Tribute to Life. We had 2 advisory panels. One was to open the doors within UK for all these important stakeholders. And the UK advisory panel is very ably chaired by Baroness Finlay, who has actually been supportive to this project right from day one. And without her support, I don't particularly think that we should have got here as we have. But it was not the project for UK, it was project for international Commonwealth communities. And therefore, we needed the International Advisory Panel to be able to give us the support, us means the Tribute to Life Board, the support that was necessary. And we approached people, and there were 2 types of representations which very quickly became prominent. One was some governments, they appointed the representatives to the Tribute to Life Board, International Advisory Panel, such as Mauritius, India, Pakistan, New Zealand, Australia, Singapore. But equally, we knew that it doesn't matter how hard the government tries, unless the people want to do it, it's not going to happen. So we sought the volunteers who are going to join us. And we're very pleased and proud that actually there are 42 countries which have joined us so far, and that covers a population of 98.6% of Commonwealth countries, which is 2.5 billion. In the board, we have got very able people, and the names of those people are here, but every single person has contributed to the best of his or her efforts. And that has been the reason for this success, because it has been a teamwork. In the co-option of those board members, we had the pleasure of co-opting Baroness Finlay, but we also had voluntarily Dr. Osahun Enabilele coming from Commonwealth Association, Commonwealth Medical Association, being co-opted for the board. We also had a representative from the Department of Health, Chantal Bole, ably assisted by another colleague, Kay Hollis. Now, the board had a core team, and you heard that in February we had a meeting. Soon after February, what happened? You probably know it. Pandemic arrived. So we had to quickly evolve our policy of having a core team, which was basically Dale Gardner, Holly Mason, and we could not have had a better person than Cam Rai, who is in the room, to start the project. We couldn't have had a better person than Livia Torek to take it further, and we could not have had better person than Keelan Jones, who is here to complete the project. We met every Friday for 2 hours for last 2 years. Quite a dedication, and I have to say that Dale and my core team have done it despite me. We also had UK advisory panel, which was ably membered by so many people, and many of those are here today in the room, but I know that the people who are outside the room and are unable to join us, there is a good reason. So 42 Commonwealth countries, 98.6% population. Let's ask the question, what is to be done? We know that the memoranda of understanding, wherever they are, these are agreement between two parties, and they don't have any legal reinforcement. Therefore, it is quite an understanding between the two parties, whichever those two parties are. And this cannot be done because of the legal imposition, but it can be done because of the will of people. We were very clear in the beginning that there will be no financial commitment for any of the countries, because financial commitment causes problems. He didn't give this, you didn't do that much, and that can lead us to difficulties. The transportation of organs is another slippery slope, and we didn't want to be there, because that encourages unethical organ transplantation. And we are fully committed to ethical transplantation only. But as you've heard, it was basically to share the knowledge and expertise, and also we were within the WHO as well as the Istanbul ethical guidelines. What are we going to achieve? We'll share the guidelines and protocols. We'll share the best practice. You can argue that these are available on internet anyway. Through internet, you can actually see any of these guidelines. You can see any of the protocols. But it doesn't happen because of internet availability. It happens because of interest of people. Our International Advisory Panel members should be able to create that interest within their own countries by creating an implementation group, which has been the success of the MOU between Mohan Foundation and NHSBT, and we hope that this will be success here as well. These are the people who, whether they are appointed by the government or voluntarily coming forward, they'll be sharing the reasons for success. There is no single country which has achieved the best of best in organ transplantation in all performance indicators. Some are way ahead, like our country, way ahead in deceased organ donation. There are other countries like Pakistan which are way ahead in live liver transplantation. There are others like Malta who have got better than anyone else the per million population donor rate. But it's by sharing those kinds of threads willingly, voluntarily, that we will do it. We will aim towards self-sufficiency, and you've heard quite a lot about that previously. Now, the question really is that why is there disparity? More than 3/4 of the nations have joined, and 98.6% of population is covered. But there are still about 12 countries to join us. But why the disparity between the population, which is 98.6%, as opposed to countries which are three-quarters? The reason is very simple. There are small countries in Oceania where it is very difficult to have transplantation facilities with a population of 21,000, 51,000. It will never happen. There are small countries with less than a million population. How is it possible that they will create this facility? We passionately believe that whether they have the transplantation facilities or not, the citizens of that country should get the best of best. There is only one way. That is empowering the health professionals of these countries, small or large, so that they can give the best of best to their own citizens. So it's a huge step towards equality for transplantation. We also know that in African countries, there are some countries where the priorities are different within the resources that they have. They can treat so many people for earthquakes, floods, hunger, starvation, famine, so many other things. And that's right. They should be able to do that. But isn't it the commitment of all governments to look after the citizens, all of them, whether they are in need of transplantation or something else? So wherever the lives can be saved, our argument is that the lives must be saved. And we are winning because there are a number of African countries which have joined us, and there are a few which I hope that they'll see the reason and they'll be able to join us fairly soon. There have been challenges all along this path, and I must say that pandemic really doesn't need to be said. Appointment of International Advisory Panel members was not easy, but it has been done. And I've talked about the small countries as well as the African countries. We are very lucky that at the time of launch, we have had 2 outcomes already, and those are massive outcomes. One is that we have achieved the connectivity. Dr. Rashid Nashidango of Namibia is connected to Dr. Faisal Sordar in Pakistan. Dr. Rashid in Bangladesh is connected to Professor Nitya Krishnan, who is here today. Dr. Ahmed Twahir of Kenya is connected to Dr. Adnan Sharif. And these personal connections are going to make a difference because they had personal reasons that they wanted to come on board. Those personal reasons will be shared because they'll have direct line rather than writing to just the governments where the emails may or may not take priority. The second massive thing, and it's a credit to Dale, is that we have already decided to have webinars, which are weekly webinars, which will be done between now, the launch, and the inauguration, which is going to be on 22nd of July. These weekly webinars are looking after the needs of various nations. So by sharing these webinars, and they'll be recorded, and you can see them afterwards if you have missed it for some reason, by sharing these webinars, all the countries will be in a position to be able to see what can and should be done. So the key to success. What would the success look like is a very important question. Well, we think implementation groups being created will be a key to success, but there can be other parameters. I want to ask you, how should we measure the success? If you have got ideas, tell us. Because to me, each person has got a different vision about success, what the success would look like, and how it should be achieved. But we are very happy to welcome the ideas. In that area, we think the work is in progress. Well, I'm persuaded by the fact that coming together is a beginning, staying together is progress, and working together is success. I'm also very persuaded by the dream and aim. Dream requires effortless sleep, and the aim requires sleepless efforts. Sleep for dreams, but wake up for aims. I have a plea. I have a plea to all of you who are in this room. I also have a plea for those who are not here in this room, but are able to join us virtually, or will see the recorded message afterwards. Please, please, please be an ambassador for Tribute to Life. Spread the fragrance. Let everybody who can benefit from this Tribute to Life, let everyone benefit from it. For that, I thank you for your cooperation. Thank you. Thank you so very much. Thank you.
Thank you so much, Satya. It's really nice to be able to see you in person instead of on a screen after these couple of years. And thank you so much for being able to give us a really good insight into the real depth of what you've achieved and your team have achieved. So thank you very much. We now turn our attention to the Commonwealth. There are 54 member countries of the Commonwealth and a combined population of 2.5 billion people. 32 of the world's 42 smallest states are Commonwealth members, each with a population of less than 1.5 million people. We are diverse. Among us are some of the world's biggest, smallest, richest, and poorest nations. But we all share a common goal: to use the potential for the Commonwealth as a compelling force for good and as an effective network for cooperation and for promoting development. This is our Commonwealth, and this is the Commonwealth Tribute to Life. As Satya clearly outlined in his slides there, as of today, 42 of the 54 Commonwealth countries are represented in the project's International Advisory Panel, which is an amazing feat, and that covers 98.6% of the Commonwealth population. This is incredible. When we first started out, I'm not even sure if we ever expected we'd get to 98.6%. To assist the International Advisory Panel and deliver on the project, we've divided the Commonwealth into 6 geographical regions, and each with an appointed coordinator. We're going to hear from each of those 6 coordinators who will present to us what they see as their challenges, opportunities, and solutions in their particular region. And since we're here in Wolverhampton, we'll start with someone you've already met today, a key person for the project, my co-host for today, Dr. Dale Gardner, who has been with the project since the beginning and is the Commonwealth Tribute to Life Coordinator for Europe and chairs the International Advisory Panel. Over to you, Dale.
Thank you, Justin. There are 3 Commonwealth countries in Europe: Cyprus, Malta, and the United Kingdom. I'm very pleased that all 3 have joined the project as members of the International Advisory Panel. One of the biggest donation and transplantation challenges we face in the Commonwealth countries of Europe is recovery from the COVID-19 pandemic. This challenge, we know, exists in other parts of the world. For us and for the world, deceased organ donation and transplantation, as well as living transplantation, fell significantly because of the pandemic. However, in the United Kingdom, even during the height of the pandemic, we saw incredible family support for organ donation. I think this is a testament to the strong foundation of altruism and support for donation across all the United Kingdom, and the dedication of the doctors, nurses, and other healthcare professionals involved in donation and transplantation. We in the UK are witnessing a recovery, but we have yet to reach the level of donation and transplantation activity we were achieving before the pandemic. So there is much more to be done. The second challenge I would highlight are the inequalities in donation and transplantation that we have in the United Kingdom. For many patients in need of a transplant, particularly for a kidney, often the best chance of a match will come from a donor from the same ethnic background. This figure shows the continued imbalance between the need for transplants in our British, Black and Asian communities and the availability of suitable organs. Working together with partners, stakeholders, community groups and the NHS to provide education, faith and cultural engagement is more important than ever before, especially in a time when many health inequalities have been highlighted by that pandemic. If you across the Commonwealth have suggestions and advice for the UK, we would be extremely grateful for you to tell us. And this is very much at the heart of the Commonwealth Tribute to Life project, sharing knowledge and expertise. Within the Commonwealth countries of Europe, you may have noticed that pre-pandemic Malta had very high rates of deceased organ donation, the highest in the Commonwealth. Malta, how do you do it? Please, what lessons do you have for us that we can all learn from? The United Kingdom itself is strengthened by its diversity. There may be one NHS blood and transplant covering all the UK, but different donation and transplantation law and culture exists in England, Northern Ireland, Scotland and Wales, as well as the Isle of Man, Jersey and Guernsey. This creates a great melting pot for the development of ideas and growth, the outputs of which we would love to share with you, our friends across the Commonwealth. Over the last few years in the UK, we have been implementing opt-out organ donation legislation. It has been an amazing journey, and for us a showcase of the strong and widespread support donation and transplantation has in the UK. 3 of the laws are directly named in honour of 4 very special individuals, reflecting the power of people and families to drive real change. Daniel's Law in the Isle of Man is named after Daniel Boyd, who died aged 15 after a road traffic collision, and he went on to donate his organs, helping 4 people. Max and Kira's Law in England is named after Max Johnson, a young boy who, with his family, campaigned for the law to change. Max, when he was aged 9, received a life-saving heart transplant from Kira Ball, also aged 9, after she tragically died in a road traffic collision. Dahi's Law was passed by the Northern Ireland Assembly only last month. It is named after 5-year-old Dahi McGowan, who has been waiting for a heart transplant since 2018. He and his family campaigned for the law to change in Northern Ireland. Inspirational stories are just that. Inspiring. And that's what I hope the 2022 Commonwealth Games will be, full of inspiring and transformational stories. And that's our opportunity across the Commonwealth countries of Europe and across the whole Commonwealth to use the opportunity and goodwill the Commonwealth Games brings us to raise the profile of organ donation and transplantation so that we may together share our challenges, seize our opportunities and find solutions. Thank you.
Thank you, Dale. And now by live stream from Cape Town, South Africa, I'd like to introduce Dr. David Thompson, Commonwealth Tribute to Life Coordinator for Africa. David is a consultant, transplant and critical care surgeon at the University of Cape Town Groote Schuur Hospital. Over to you, mate.
Thank you very much for the opportunity to be part of this project and facilitate its outreach into Africa. Let me get the slides to come up. These are the Commonwealth countries in South Africa, across Africa. And just to give you some context in terms of the challenge for sub-Saharan Africa, it actually totals 54 countries and 1.1 billion people. And the Commonwealth offers an opportunity to network across countries stretching throughout Africa. South Africa occupies a historic place in transplantation with iconic images of the first heart transplant, and back then the picture of the first heart donor. And it continues to innovate with advances in HIV positive donation and penis transplantation. And it's not just newspaper headlines, but it's also hard-hitting scientific support for these practices and what underpins them that we would be able to share across the Commonwealth. But where do I see the biggest challenge? I see ultimately it's in scaling up our deceased donation and maximizing the gift that transplantation can give to patients with end organ failure. And we need to maximize this. And we need to do this to address inequality. Organ donation and good end-of-life care is a public health need, and access to health is key in Africa. And we need to realize that our ambassadors in the African continent are going to be the dialysis doctors who are trying to support patients in the best way possible in often very challenging circumstances. But this is where we can build the leverage to grow transplantation and donation services. How do we embed donation as routine in end-of-life care? There's no culture or society that doesn't want us to help our fellow man, and we need to maximize this in various ways. And the solutions would be to link organ and tissue donation and help improve all end-of-life care. This makes the donation a possibility in so many more circumstances. We need to support local guideline creation between our countries. We've got excellent guidelines. We've got the same education systems in the Commonwealth, and we need to define best medical practice to support practitioners. We need to use this to create local champions And then the legislative engagement can happen when the best medical practice has been defined and agreed upon by the clinicians leading it in the country. We can share our educational resources, from novel online education resources and advances in simulation training and dealing with grieving families. And we can record and share our data. And I use this powerful slide from the UK Potential Donor Audit in all my talks to highlight the process that needs to go in and all the opportunities for quality improvement in terms of the donation process, because these are part of our social contract with the population. So ultimately, what do we need to do? We need to leverage a network opportunity such as this one. It's a great opportunity to be part of this. The life-saving benefits of transplantation from just one donor can profoundly alter people's lives. And we need to stretch our reach across the Commonwealth. Thank you very much for this opportunity.
Well, thank you, David. So while I have told you of Satya Sharma's efforts for this project, Dr. Sunil Shroff's commitment has been just as long and just as strong. Sunil is a senior consultant urologist and kidney transplant surgeon and the founder and managing trustee of the Mohan Foundation in India, whose Memorandum of Understanding with NHS Blood and Transplant formed the model and the template for the Tribute to Life project. Sunil is the current president of the Indian Society of Organ Transplantation, and he has been a powerhouse in growing deceased donation and transplantation in India. His influence, friendship and dedication is felt across the world. He is absolutely the right person to be the Commonwealth Tribute to Life's coordinator in Asia.
Thank you so much, Dave. It's a proud privilege to be here today and represent Asia, which consists of 8 countries. I changed my slides, yeah. And these are represented by 8 champions of organ donation in this region, which includes Dr. Harun Rashid from Bangladesh, Dr. Jackson Tan from Brunei, Dr. Vasanti Ramesh from India, Dr. Yaha from Malaysia, Dr. Ibrahim from Maldives, Dr. Faisal from Pakistan, Dr. June and from Singapore, and Dr. Vajira from Sri Lanka. Can I get my slides to change, please? So somehow it's stuck. Sorry. This region is a very densely populated region, and it consists of almost 1.7 billion people, with 1.3 billion being from India and then Pakistan, Bangladesh. And in this region, we have 6 countries which either do tissue or kidney transplantation, living kidney transplantation, except for Maldives and Brunei. 6 countries do transplantation. Disease donor transplant happens in 4 countries: India, Sri Lanka, Singapore, and Malaysia. Heart and lung transplant happens in 3: India, Singapore, and Malaysia. The COVID-19 impact has been big in this region. Almost 40 to 50% drop in the cumulative figures of transplant in the region, be it kidney, liver, heart, or lung transplants. Chronic kidney disease is a huge challenge in this region. The incidence of end-stage renal failure is 232 in countries like India and Bangladesh, and it is as high as 503 per million population in Singapore, and most of these patients in Singapore are diabetics. There's a rising incidence of lifestyle diseases leading to chronic kidney disease, be it diabetes or hypertension. The requirement for kidneys in this region is close to 450,000. Only 100,000 receive some kind of renal replacement therapy. There are certain risk factors for chronic kidney disease in the region. The low birth weight leads to less nephron mass, and many patients have to travel great distance to get tertiary care. There's no health insurance either. This is a busy slide, but the reason I brought this slide is to show you the infrastructure and manpower as far as kidneys is concerned. In this region, we have 1 to 10 nephrologists per million population, compared to 40 in Spain and 28 in the US. And the lack of trained manpower and infrastructure hampers preventive measures for early diagnosis, prompt management of chronic kidney disease. The organ transplants from last 6 years in the region, there are some stats which shows you kidney transplant figures from India. We do close to 10,000 kidney transplants. Liver transplants close to about 2,000, 2,500. India also does hand, pancreas, intestine, and lung and heart transplants. Bangladesh does about 200 odd kidney transplants. Sri Lanka does about 300. Pakistan does about 1,300 kidney transplants in the region. The demand is big, huge, but the supply is less. As far as liver, heart, and lung transplant, again, this slide shows the figures from Pakistan. The live liver transplants, almost 280 odd, and India does, close to about 300 to 400 heart and lung transplants. So much about what is happening in the region. What is the learnings in the last 20, 25 years? If we felicitate organ donors all the time like other countries, and that creates a good feel factor in the region. We distribute organ donor cards to individuals, but we realize that doing family donor cards is even better, where the whole family pledges for organ donation. Having a clause on driving license helps. This has happened recently in India, and I'm told that in 12 months, 20 million people have opted for organ donation. We do have required request, and this works like a soft opt-out option for the ICUs. When we have celebrities endorsing organ donation, it really helps in public engagement. We need to create awareness among the public all the time on organ donation, but it is equally important to create awareness in this region among the doctors and medical professionals to talk about issues related to donation and transplantation. Other learnings have been in initiating our conversation about organ donation with families. Eye donation is very popular in the region. In Sri Lanka, almost every fifth person has blessed their eyes. So asking for eyes first is a good way of starting conversation with families for organ donation. In medical legal cases, we have realized, like road traffic accidents, it's good to have a police officer on the board as a nodal officer to ease the whole organ donation process. When we train doctors for ICUs, we must also train critical care nurses. We need to continue to run brief-line counseling courses for nurses, coordinators, and doctors in this program. And our organ retrieval courses, which we have tied up with Oxford, has paid rich dividends because it has led to better graft outcomes and starting of new transplant programs. Our capacity building to train transplant coordinators in the country, in the last 12 years, we have trained close to 3,000 transplant coordinators. We also train coordinators from other countries due to low cost of our training program. We have some models of excellence in this region, which deliver quality care. The eye donation program in Sri Lanka and India are very big. India does close to 40,000 eye donations every year. The Sindh Institute in Pakistan, led by Dr. Rijvi, does a great job. They don't have any billing counter in their hospital. Everything is done free. The National Kidney Foundation by Dr. Harun Rashid in Bangladesh is doing great work. And so there are a few programs in India, like the Satya Sai Hospital, the IKRDC in Ahmedabad, and Tanker Foundation, which are doing great work. Can you change the slide, please? Yeah, sorry. Organ donation also is creating some harmony in the region. Initially in the program, we had patients from Pakistan who were getting heart transplants in India, and that was, created a lot of good feel factor. And we have also Hindus donating to Muslims, swab donations happening in the region. And this is my last slide. Ours, the Commonwealth Tribute to Life is about sharing best practices, learning from each other. And as Satya and Gail said, 7 years back, we had an MOU with NHSBT, which we signed in House of Lords. And that's when our best practices started. We have developed an app for donor maintenance for ICU consultants, which has been downloaded more than 2,000 times by various consultants, and it's freely available on the net. We also have a very interesting report of our achievements of the last 5 years on our website. Thank you very much, and great to be here this morning.
Thank you, Sunil. Some really good information coming out from that region, so thank you very much. Heading forever east around the globe, I welcome Ms. Lucinda Barry, Commonwealth Tribute to Life Coordinator for the Pacific. The area of the world obviously is pretty important for me and Dale, both being Antipodean, even if they are just the West Island of New Zealand. Since 2007, she didn't like that. Since 2017, Lucinda has been the Chief Executive Officer of the Australian Government Organ and Tissue Authority. We're delighted that Lucinda has taken a senior position in the Commonwealth Tribute to Life project, and we have her here by live link from Canberra, Australia. She's going to share with us the donation and transplant challenges, opportunities, and solutions for the Commonwealth Pacific region. Over to you, Lucinda.
Good evening from Australia, and thanks very much for having me. I won't make a comment on us being to the west of New Zealand, though. Thank you very much. What an amazing opportunity it is to be here. As you will see from my slides, sorry, I'm just getting my clicker going as well. From my slides, there's 11 countries in our Pacific region, and as such, I pointed out, some of our countries are quite small. We've managed to get 4 countries signed up so far, but there is more work for us to do at the moment, but I'll give you a little background on our countries, I hope. As you can see from this slide, our smaller Pacific Islands are exceptionally small. We've only got in the region, there are 3 countries with over 1 million people, and we go down to about 10,000 people in Nauru. Also, the other demographic issue that we do come across is Australia, as you can see, is quite large as well. So flying time from east to west in Australia is at least 5.5 hours for us to try and manage that as well. So some of the challenges that we do have is just the layout of the Pacific itself and the size of our countries. But just to give a little bit of background on the health services in our countries, so Australia has a full national organ donation and transplantation system, both deceased and living. New Zealand does as well, and both PNG and Fiji have dialysis services. But for the rest of our countries, really the whole focus is on primary care and prevention in those countries. They are also being significantly impacted as well with COVID. So it has been difficult at this point to reach out to some of the countries when they're trying to deal with basic care and the impacts of COVID. Many of them don't even have a hospital. They just have a local health service. So we will be reaching out to those once this crisis for them is easing a bit more. I'm hoping that's going to go. Just to give you a little bit of the challenges, of course, COVID has been a challenge in our region, as it has been everywhere else, and I thought I'd give you a little bit of information about Australia. As you can see, Australia was in 2019, we're at over 22 donors per million population, and that came about because a whole national program was put in place in 2009. So the Organ and Tissue Authority that I'm CEO of leads the national program, but we have a Donate Life agency in each state and territory, and we cover 95 hospitals in Australia with over 275 donation specialists, medical and nursing staff. So we have seen a significant increase, as you can see, 122% increase in deceased organ donation with an 80% increase in transplantation. But the last 2 years, we've seen overall about a 25% decrease in donation. And of course, that means that there's less people receiving a transplant. So we really do need to look at how we can come out of the challenges at the moment. And we will be looking to our Commonwealth countries to talk about that. In fact, we have been talking to them every month about what's going on. And it is great that we have been able to build up that collaboration already already. We've also seen challenges with living donation. The turquoise graph shows living donation without being in a paired kidney exchange. The paired kidney exchange is the dark green, and in fact at late 2019 we launched the paired kidney exchange program between Australia and New Zealand, and then COVID came along and our international borders have been closed. So the program has continued, but it's continued in each country. So we are looking to increase that, but as well, the standout there is that living donation has dropped off as deceased donations increased in Australia, and New Zealand has a very high rate of living donations. So we will be working closely with them to learn about their success in that area as well. Opportunities, lots and lots of opportunities with this, not just in our region, but also across all of our Commonwealth countries. As I said, Australia is now 12 years into its program, and we have a number of guidelines and training that we have got. A couple of those there, in particular, our program for talking to families in having the conversation. We have now online web coaching with that as well. So there's a number of key documents that we have. We also share with New Zealand the document on clinical guidelines for organ transplantation. So very happy for all of these to be shared. As I talked about as well, collaborations. We have been working with New Zealand already, and the Transplant Society of Australia and New Zealand is a key member of this group. We've also reached out to Pacifica Medical Association, which actually covers all of the Pacific Islands, but their focus at the moment has been on COVID, but they are keen to meet and discuss that with us. And Donate Life is our Australian logo, and we work very closely with our teams across Australia to do that, but it's all about collaborations. And other opportunities, as we've heard from before, we need the community to actually, support donation. And in Australia, we've done a recent survey that's shown that 4 out of 5 Australians do support donation, but they haven't taken the next step and registered. One silver lining out of COVID from last year was we had a 87% increase in registration on our national registry. We had a race, the Ready Set Register, aiming to get 100,000 registrations, which we were able to achieve. But we look at a lot of different ways with our campaigns to try and lift the public support for donation, and we have quite a multicultural community as well, but I think we can all learn from each other in those areas as well. And I just want to say what an amazing opportunity for all of us, and a big thanks to Sacha and Dale for your leadership and drive on the program. You have made sure that we've come together every month, and I look forward to seeing where we go in the next 5 years.
Thank you, Lucinda, and the Opera House looking beautiful in pink, as we saw there. Many of us across the Commonwealth have benefited from working with Canada, whether it's help with interpreting what happens from their bigger neighbour down south, the United States, or their leadership and friendship in many areas of healthcare. In the worst of the pandemic, Canada was holding a monthly meeting, bringing experts from across the globe to discuss fine ways of how we keep donation and transplantation going. The guidelines Canada produces on donation and transplantation, the world-leading research it delivers, are exemplars of excellence. And through the Commonwealth Tribute to Life project, we now have the opportunity, all of us, to benefit from Canadian know-how. I welcome via live link from Ottawa, Canada, Ms. Catherine Butler, Director of the Canadian Blood Service and the Commonwealth Tribute to Life Coordinator for the Americas.
Well, good morning, everyone. At least in Canada, it's good morning. Although I wish I could be there in Wolverhampton with you because it sounds like a lovely community. Alas, I am not. But I would like to say that given that one of your co-hosts, Justin, is from this part of the world, we'd like to say you're welcome. As Dale has mentioned, there are fewer Commonwealth countries in the Americas, but we do have Belize, Canada, and Guyana, all of which are a part of this project, and all of which I'm absolutely honored to help support and coordinate in my role in this part of the world. Oh. My slides are not advancing. Thank you. To tell you a little bit about the Americas, there's a big difference in the three countries that are involved in this project, as you can see from some of the data that I've provided. Canada is by far the largest. And I hear we're a little bit colder than either Belize and Guyana, which are in Central and South America. Population sizes are quite different. Belize and Guyana are relatively small compared to the monster that sits on top. Even our healthcare systems are quite significantly different, varying between public and private in Belize and Guyana, as well as a more modern, more publicly funded, mostly publicly funded in Canada. Where Belize and Guyana, as we're connecting and learning more about their systems, they're very focused right now, and I believe that many other speakers have acknowledged that COVID has been quite stressful, and most likely far more so for the smaller systems and health systems in the smaller nations of our world. And right now there's a very huge focus in Belize and Guyana on dealing with COVID and its impacts. Many of the health services in the country are quite public health and primary care and prevention focused at this point in time, with small tertiary sectors and in some places non-existent tertiary care. So the focus that they have on COVID is well understood, and we're looking forward to being able to connect with them a lot more so once they're able to get past this crisis. Secondly, and as you'll note from the data that I'm going to present in the slides going forward, there is a fairly significant data gap as well in terms of what's able to be provided for data. What I can tell you about Belize and Guyana is that both of them have dialysis and basic kidney transplant programs, corneal transplant in Guyana as well. And there's legislation that was recently passed to allow cadaveric transplants, and that is going to be their focus in the coming years ahead. In Canada, I'm going to share a little bit more with you. As you can tell from the slide in front of you, we have a very complex landscape. We have 10 provincial organ donation organizations. So Canada does not have a national system. We have a number, it's a federated system. So we have a number of provinces that all have their own organ donation programs and transplant programs, 27 living donations and 25 kidney paired donation sites, as well as specialized HLA laboratories and ion tissue programs, as well as close to 300 intensive care units. The role that we play as Canadian Blood Services in the system is really that national coordination piece. We work with collaborators across the system in critical care, in emergency care, in organ donation, transplant programs, ion tissue banks, professional societies, researchers, patient groups, as well as Canadian Blood Services as the national coordinating agency. We work with the system overall in order to help support national initiatives, donation and awareness campaigns, overall system improvement practices, in support of national data, gathering national data. My slides are very slow. On the right, you'll see some data that I've provided as well, just about 2021 statistics. So just to give you a sense of cumulative donation results to date in Canada, as you can see over a comparator between 2019 to 2021, just over 730 deceased donors were reported in 2021, pretty much on par with deceased donation that was reported in 2020. Living donation was up by close to 30% in 2021 relative to 2020, but both living donation and deceased donation have remained lower in 2021 than pre-pandemic conditions that you'll see in 2019. With the exception of heart transplants, organ donation or organ transplantation activity did increase in 2021 relative to the previous year. This increase is still lower than the 2019 levels. So what are some of the challenges and opportunities in the Canadian context? Not so dissimilar to many of the other Commonwealth nations that have been expressed. COVID meant decreased rates and program disruptions, incredible health workforce challenges in Canada that we will be dealing with, I suspect, for many years to come. We've lost a number of very skilled experts in our programs to other parts of the system, or sadly to attrition out of healthcare altogether. In Canada, we have significant geographic, social, and racial inequities in our system. As advanced as our system may be, we still have a wide disparity in outcomes and programs between the northern parts of the country and the more southern populous parts. We also have racial inequities between our Indigenous population and our immigrant and new Canadian populations. We have persistent misdonation and mistransplant opportunities, significant variations, again, across geographies that we consistently work towards improving. We have inconsistencies in practices and outcomes across programs and countries as well, or programs and areas as well. As you saw a little bit earlier, we have over 10 programs that we coordinate, hundreds of specialists, and you can easily understand where practices would vary. Our focus is really to learn what those are. I'm sorry, I'm going to go back. One of my slides is jumping ahead here, sorry. National coordination and accountability is always a challenge in Canada because of the complexity of the system. Some of the opportunities that we have that we share with other Commonwealth nations are around the opportunities for national and international collaboration. Dale spoke earlier about the ability to link with our international partners throughout COVID, and we are certainly committed to finding a way to continue that process as we move ahead in recovery from COVID in terms of advancing the system. System change and governance is always challenging. National data collection and reporting in Canada has been a challenge because of the reasons I identified earlier. We are working to ensure that we do have a national reporting system that is robust and timely. Advances in interprovincial organ sharing, such as shipping kidneys, has been an incredible opportunity that happened during COVID. And just to give you a sense of that, when we share kidneys across provincial boundaries in our country, we have a difference of 8 hours from one coast to the other, not dissimilar to Australia. So being able to do that means that we have to be able to find a way to act, to timely, to responsibly get kidneys from one end of the country to the other where possible, and from province to province. We also have the opportunity to really be able to address our inequities by bringing a diversity, equity, and inclusion lens to the work that we do. And that is a huge focus for us in Canada, and especially for Canadian Blood Services. My clicker is very slow to move things ahead. This gives you an example of some of the data that we're providing nationally without going into detail. This has been a development through COVID because we finally were able to get 10 provinces to submit data to Canadian Blood Services so that we could provide a national picture of the performance within our own system. So what are some of the opportunities that we really see within the the Commonwealth Tribute to Life program? We see the opportunity, as all other countries have identified, for information and knowledge sharing across the systems. We certainly know that in Canada, we have multiple clinical tools and resources that we would love to be able to share, as well as being able to look forward to learning from other countries across the world in terms of the advances that they've been able to make. Public education and awareness resources and campaigns are another area that we feel we can contribute to as well as learn from in terms of being able to change the culture of donation and transplantation in Canada so that Canadians and other folks across the world start to see donation as the norm and not the exception in healthcare. As well, the opportunity to provide access to conferences, scientific meetings where more of that sharing can occur is a critical outcome that we're looking forward to participating in. And that international collaboration through opportunities like the Commonwealth Tribute to Life is an area that Canada, as well as the Americas, are really excited about participating in because of the outcomes that we know are possible that have already been so adequately and eloquently expressed by others on the call. We look forward to this and to the years to come. Thank you.
Thank you, Catherine. Especially excited to hear about trying to make organ donation the norm. I think we all like to hear that, and it's nice to be hearing it out loud. The final region of the Commonwealth is the Caribbean, one of my favourite places to visit in the Commonwealth. Our project is wonderfully served there by the coordinator for the Caribbean, Dr. Margaret O'Shea. Margaret is a consultant surgeon in Barbados and worked with the Transplant Links charity to start a kidney transplant program in 2016. She helped secure the support of the Caribbean College of Surgeons as a partner organisation for the Commonwealth Tribute of Life, which is an amazing feat. Please tell us more about the Caribbean, transplant challenges, opportunities and solutions that you see.
Thank you, Justin. Good morning, everyone. Thank you for including the Caribbean in this wonderful project, especially thanks to Satya, who brought me in, and to Dale, who keeps all of us together over the last year or so. The Caribbean, as you can see, represented by these islands, and I'm pleased to say the majority of them have signed on to be part of the MOU for this wonderful project. Okay, next slide, please. The total population, we do have variations, as I saw Lucinda present, for the Australia and surrounding countries, from all the way from 3 million in Jamaica to smaller islands as little as 54,000 in St. Kitts and Nevis. But we are united, and thanks to this project, even more so. Next slide, please. Many of you may know the Caribbean for beautiful beaches and Carnival, and more recently Rihanna, but we do have transplantation going on in our region since 1971, actually, in Jamaica, renal transplantation. And currently we have 4 islands involved in transplant activity. Trinidad and Tobago, most notably, has the largest program, and this is the only island that reports to the WHO their transplantation activity. In Jamaica, we have renal transplant. Also, recently, they started a liver transplant program as well. And we do have kidney program in Antigua and Barbuda and in Barbados as well. Next slide. What types of activity? Mostly living donor kidney transplantation. There is a deceased donation program in Trinidad and Tobago. They have the longest and the most active program, and they also have a deceased donation program that's doing quite well. As I mentioned, Jamaica is the only one with liver. We do have some tissue transplantation going on in Barbados and Trinidad with corneal transplant. Next slide. We have a great need for transplantation in the Caribbean. I think everyone mentioned especially Sunil in India, the rise in the non-communicable diseases, diabetes, hypertension has affected us greatly, and obesity. And this is leading to increasing rates of renal failure across all the Caribbean. Dialysis is the mainstay of treatment because of the lack of enough transplant programs. So we do have hemo and peritoneal dialysis as a mainstay for renal failure in most of the countries. And for liver failure, as I said, in Jamaica, they've just recently started a program, but this is also an issue for our patients. Next slide. This slide of peritoneal dialysis rising in our country, Barbados, can be used for all of the islands, actually. This steady increase over the years because of this increase in hypertension and diabetes that is basically just going up and up in all of the countries. And we really have this important need then for getting these patients off of dialysis and onto a better and more effective quality of life. Next slide. We do have proof of concept in the Caribbean. Despite our low income, we have great expertise. A lot of our doctors involved in transplant have had their training in high volume centers internationally. So we have what I would like to say are fishermen. What we need really are the boats to continue. We have excellent surgeons, nephrologists, transplant coordinators as well that have all had their training in high volume centers. So we have great expertise here. Through partnerships with international organizations, Transplant Links Charity, DTI, and out of the US, Miami and Toledo, they have helped bring skill to the Caribbean in the form of skill transfer, which is what we really want. We want to be able to be independent and have our own activity within the region. And partnerships such as these bring that kind of skill transfer to us, that we can continue our programs in our countries. Next slide. As I said, successful outcomes. This is a picture of one of our recent peers, and there are many of these successful outcomes that we know. We have the infrastructure. We have fantastic hospitals, good healthcare. So what we need then is to have more buy-in from our ministries in order to improve these outcomes. Dialysis is very expensive. Next slide, please. And the cost goes up and up for dialysis. And we all know, I don't have to tell this esteemed audience, that transplantation is better. So this is why we want to have the needs for successful transplant programs, sustainable transplant programs. We don't want it that we just have these one-off situations. COVID has affected us as well, as everyone else is saying. We are looking to supporting organizations. This one in particular has been extremely beneficial, the Commonwealth, the Pan American Health Organization, as well as our Caribbean community. We are seeking to have increased legislation in all of the islands. In Barbados, we are close to it, and we also anticipate that for the region. More public awareness, even just with this joining of this Tribute to Life. This has just started the whole public awareness campaign within the region, and it's been a fantastic partnership already. Next slide. Even this initial part of the partnership has motivated me to get, as Justin said, the Caribbean College of Surgeons on board as a supporting organization. We've already formed a partnership with each other, and I look forward to further collaboration with my Caribbean colleagues to improve transplantation within the region. Successful organ donation within the region are all the hopes that I have for this collaboration. We also hope to have a Caribbean Donation and Transplantation Society sometime in the future, where we can bring in other members of the transplant group besides surgeons, our nephrologists, hepatologists, and also our coordinators. So I can only see great positives from this collaboration. And I really hope the next 5 years, we will see an increase in donation and transplantation within the Caribbean. I thank you so much.
Well, thank you, Margaret, and I'd like to thank my fellow regional coordinators across the Commonwealth for all you have done and all you will do as we launch the Commonwealth Tribute to Life project. So as you have heard repeatedly, the real work begins tomorrow. This is only the start. Over the next 4 months, we will building momentum that will lead us up to an inaugural ceremony on the 22nd of July, where the official start date of the Memorandum of Understanding will begin for its first 5-year term. We have 42 out of 54 Commonwealth nations. We're ambitious. We want 54. So if you saw some of those missing nations and you know how to get in contact, help us out here. But the ambition is really clear for us to share knowledge and expertise. And as a start and a proof of what is possible, we'll be holding weekly 1-hour Zoom webinars and we'll bring experts from across the Commonwealth to share that knowledge and expertise. We're developing the program, it's in full development, and we will be starting these webinars next week. So, most importantly, share that they are occurring with your colleagues. Look at that list of collaborators. These are all the organisations that's come on board. This is what the shared nature of this program is. It's incredible. So in the 4 months ahead of us, we need to collaborate like never before, so that as we draw towards that inaugural ceremony on the 22nd July 2022, we will have created a network of healthcare professionals, champions and ambassadors for donation and transplantation like the world has never seen. To know how we might achieve this, I'd like to invite to the stage Ms. Holly Mason, Head of Organ Donation and Marketing with the NHS Blood and Transplant and a core member of the Tribute to Life team.
Thank you, Dale. So the Commonwealth Tribute to Life project presents an incredible and unique opportunity to create a legacy for organ and tissue donation and transplantation, not just in the UK, but across the Commonwealth, to save and transform lives. So how can we do this? Celebrate the inspiring stories of our donors, donor families, those waiting for a transplant, and those whose lives have been saved and transformed. To normalise the culture of organ donation across the Commonwealth to benefit all nations. By empowering communities and addressing concerns and barriers to donation, we can help to save and transform more lives and help to address health inequality. We have a very exciting 4 months ahead of us. This is very much just the start. And the Tribute to Life project presents many opportunities for us here in the UK, but also to collaborate across the Commonwealth. As an official legacy project of Birmingham 2022 Commonwealth Games and part of the United by Birmingham 2022 community programme, this gives us a real opportunity to make an impact in Birmingham and the West Midlands. Birmingham is one of the largest transplant centres in the world and also home to the only donor centre in England that collects blood, platelets, plasma. So working collaboratively with our colleagues, we can not only create a legacy for organ donation, but all forms of donation, saving and transforming even more lives. To create a legacy locally here in the West Midlands and throughout the UK, we need support. And this project gives us an opportunity to engage existing supporters, but also to reach out to new partners and stakeholders to be part of something truly life-saving. We fund grassroots organisations to engage their communities on organ donation, and with many projects having ties to the Commonwealth, we want to support and amplify this incredible work they do within their communities. We want to collaborate with high-profile Commonwealth Games athletes on truly impactful content, and more to follow on this in a moment. And real-life stories, as we've heard, and we will come to hear in a moment as well, they're incredibly powerful. They not only captivate the media, but the hearts and minds of the public and inspire people to be donors. So all throughout our work, we will celebrate the gift of life and provide real hope for those in need. So I've touched on what we want to do here in the UK, but we also have an ambition to create a United by Donation and Transplantation Commonwealth video, a collaborative video highlighting and demonstrating that organ donation and transplantation is a shared human experience by hundreds of thousands across the Commonwealth. And we can all work together to give a better chance at life to all. And we're looking for Commonwealth team captains. As we've heard, sport can be transformational, it can unite, and it would be amazing if each Commonwealth nation could obtain the support of a Commonwealth athlete to be an advocate for organ donation. This would give an incredible opportunity for each nation to use this trusted voice to engage the public, but combined it has the potential to really make a difference. So we're excited by the opportunity to raise the profile of organ donation and transplantation, both here in the UK and across the Commonwealth together. So thank you.
Well, you've certainly given us a lot to do, Holly. But why are we doing this? Why do we do this? Why do donors and donor families say yes to helping others in such a selfless way? I think they do it because they see a human connection to save and add life and give hope to those in desperate need. I want to bring onto the stage an amazing young lady, Makina Straker-Sharp from nearby Oldbury. Makina received a heart transplant aged 5, and she's going to tell us her story. Thank you, Makina.
I was born with half a heart, which means the left side of my heart didn't develop properly. I had my first heart operation just 5 days old so I could survive. I then had another at 9 months and a further one at 4 years old. Unfortunately, after the third operation, I became very unwell and suffered from heart failure 6 months after. I went to the Freeman's Hospital in Newcastle to be assessed whether I could be placed on the transplant list in May 2013. I had a cardiac arrest on the second day and had to stay in hospital until a heart became available for me. Luckily for me, I had a transplant on the 12th of June 2013 and stayed in hospital for 4 months. I was given the greatest gift, life. I had been able to go to school and do normal things like any other child. I became very poorly in November 2014 and was diagnosed with PTLD. I spent 2 months in the RVI Children's Hospital in Newcastle having chemo. I have taken part in the Winter Transplant Games, the British Summer Games, representing Great Britain in skiing, track and field events. My mum got me a personal trainer to help me prepare for the Games. It was tiring at times, but it was all worth it when I was representing GB. I'm proud of all my achievements, as I couldn't have done it without Lynn Holt, my parents, family and friends. For the first time in my life, I met children who were just like me, and we all had organ transplants. I have made lots of friends from all over the world. I enjoy fundraising for charity and raising awareness of the importance of organ and blood donation. I would like to thank my donor family for making such a brave decision when they lost their loved one and giving me a chance to experience what life is like. Also, I'd like to thank the cardiac transplant team in Newcastle and Birmingham Children's Hospital for looking after me. Thank you.
Thank you, Makina. You are one of those joyful, inspirational champions that just really reminds us why we do this. And you living life well is the best present we could get. To close today's proceedings, I would like to invite onto the stage Baroness Finlay of Llandaff. Lady Finlay is a doctor, professor of palliative medicine, and a member of the House of Lords. She has been a firm supporter of the project and is chair of the UK Advisory Panel. As Dr. Sharma mentioned, I well remember meeting her and other senior leaders of NHS Blood and Transplant in the House of Lords, where the ambition of this project was hatched. Thank you for all you've done, and I can think of no better person to formally close the launch. Baroness Finlay of Llandaff.
Thank you. Thank you, Dale. Thank you, Satya. And thank you particularly, Makina, and your family for sharing with us today, as well as Justin, sharing your stories and just how transformative transplantation is. When Satya first discussed the concept and vision of Tribute to Life as a project to me 3 years ago, it was difficult to imagine the outcome, but I felt honoured and was completely taken in by Satya's sincere commitment. And it is amazing that we are here today in Wolverhampton, where Rosemary Cox set a foundation that we've been able to build on, and where, Mayor, you have actually underlined the importance of every citizen in our societies being involved. The achievements of this project have vastly exceeded our expectations as a result of the contributions of so many. I can't name them all, but they know who they are, and every person's contribution has mattered. Our ambition was clear: to use the opportunity of the 2022 Commonwealth Games in Birmingham as a focal point, to shine a light on the importance of organ and tissue donation, of ethical donation and transplantation. Our project has been endorsed by United by Birmingham 2022 Legacy Charity, because they believe, as we all do, that we can make a tangible difference leading up to the Games, and even more importantly, after the Games have finished. Our goal then is legacy. As you've heard, the legacy only starts from today. It isn't this wonderful event today, this is just the beginning. It's fantastically enjoyable and very informative. But legacy is built on those historic ties, those personal links and friendships that extend right across the Commonwealth. By bringing people together, we can all be a real catalyst for change and tackle the health inequalities that are only too evident, both in our own society and everywhere across the Commonwealth. That's the purpose of an MOU, a Memorandum of Understanding. And on the 22nd of July, a week before the opening ceremony of the Commonwealth Games, we'll hold an inaugural ceremony to mark the official starting date of the memorandum. So this is the beginning of the beginning to the lead up to that date. We hope by then all 54 Commonwealth countries will join us. So everybody who's got a contact with one of them, please use it. Please press the buttons, make the phone calls. Satya's phone bill is massive already from all the phone calls he's made. Because the memorandum will give us a framework by which we can establish a connected community of expert healthcare professionals and policymakers to share knowledge, to advise, and to help each other on the topic of donation and transplantation for the benefit of all the citizens across the Commonwealth. We must exceed our pre-pandemic levels. We must go far further than those, go beyond and reach new heights in the years ahead. And I believe that our connected community of experts is already in this room and on Zoom and watching online, supported, I would say, by our own Secretary of State for Health as well, which is fantastic. That connected community can really make things happen. So thank you all for joining us today for the launch of the beginning of the Commonwealth Tribute to Life project. And I would like to say particularly a thank you to both Dale and Satya, who have been absolutely pivotal in their roles to make sure that the project works really well and does indeed provide a lasting legacy, not just a blip, but something that in the decades ahead, people will know made a real difference. So I look forward to seeing you all together, building this legacy together with everyone here. Thank you all for all your efforts. And I have to say, keep going. Thank you.
And that concludes our proceedings. Lunch awaits. Thank you for being a fantastic audience. There'll be some entertainment and lunch kicking off around 1 o'clock. Thank you very much for this wonderful event.